I'm going to show you different rooms and spaces in the lower limb. First of all, here you can see the inguinal ligaments. As you see, it's between the ASIS or anterior spherical spine and pubic tubercle. And below to the inguinal ligament, we have a triangular space here. Here's a triangular space, which is called femoral triangle. And it's a space between the inguinal lingual at the top and at the medial border of the sartorius muscle. Here is the sartorius muscle on the lateral side, and on the medial side, the medial border of the adductor longus. So this triangle, femoral triangle, is between these three parts: ligament, inguinal ligament at the top, sartorius on the left side or on the lateral side, and adductor longus on the medial side. And you can see some structure passing through this, and some muscles form the floor of the this triangle. You see here is the iliacus and psoas. They make iliopsoas. Here is the iliopsoas on the lateral side. On the medial side, you can see pectineus. These two muscles make the floor of the femoral triangle, and you can see femoral artery, vein, and nerves passing through the femoral triangle. And as you see, here is the sartorius. Deep to the sartorius, we have a canal which is called subsartorial canal. Sub means underneath. And the other name of subsartorial canal is Adductor Canal. Why it is called adductor? Because it is next to the adductor muscles. That's why it is called Adductor Canal. And you see here is the Adductor Canal, and it ends inferiorly to the hiatus. Here is the hiatus. Adductor canal acts like a hallway, and adductor hiatus acts like a passageway or doorway. So these structures pass through this doorway and goes back to the knee joint. So we have adductor canal or subsartorial canal, and it ends to the adductor hiatus, which makes by the adductor magnus. So the roof of the adductor canal is formed by this muscle, which is called sartorius, and the the lateral side is made up of medial vastus medialis, makes the lateral side, and adductor magnus below and adductor longus above make the medial side of the adductor canal. So here is the sartorius, vastus lateralis on the lateral side, adductor longus, adductor magnus on the medial side. They can make the borders of the adductor canal. Then, so here is the femoral triangle, adductor canal, adductor hiatus. At the back of the knee joint, we have a quadrangular shape or diamond shape space, which is called popliteus. Here is the popliteal area or popliteal fossa. The superior borders of the popliteal fossa is made up of the hamstring muscles. Here you can see in the medial side, you can see semimembranosus and semitendinosus muscles. On the lateral side, you can see the biceps femoris. So these hamstring muscles make the superior borders of the popliteal fossa, and the inferior borders are made up of the medial head and lateral head of the gastrocnemius and plantaris. They make the inferior borders. And his space, you see here is a popliteal artery and tibial nerve and a popliteal vein passing through this fossa and goes down to the leg. You see here is the tibial nerve, popliteal artery, and popliteal vein. And we will go to the details then. And finally, there is a space behind the medial malleolus. Here is the medial malleolus. Behind the medial malleolus, we have a space which is called Tarsal Tunnel. It is so close to the tarsal bones. That's what it's called, tarsal tunnel. And as you see, three tendons and one nerve and one artery and vein passing through this tarsal tunnel, and it goes down and crosses the sole of the foot. So it is called tarsal tunnel. Yeah, it is deep to the I'll show you this. Here is the medial malleolus, here is the calcaneus, here is the flexor retinaculum. Deep to the flexor retinaculum we have tarsal tunnel, and you can see three tendons and one artery and one nerve here. Here is the tendon of the tibialis posterior, and here is the tendon of the flexor digitorum longus, and this one is the flexor tendon of flexor hallucis longus, and the nerve is tibialis nerve, and the artery is posterior tibial artery. Tom, Dick, and Harry is the mnemonic that can help you to memorize or remember the order of the content of the tarsal tunnel. So, thank you.